You're listening to UIC Radio, broadcasting 24/7 at uicradio.org. Welcome to the Dr. Paula Show. I am your host, Dr. Paula Allen Mears. This particular broadcast is being co-sponsored by SOAR Radio, located in Rockford, Illinois, and we're delighted to have SOAR Radio as a partner for this special broadcast. Today, we're going to be talking about healthcare and managing one's healthcare. But before we move into the programmatic part of our show, I want to say a little bit about Rockford Ready. Rockford Ready is a funded project funded by the Department of Health and Human Services in Washington, D.C. And it has been led by and being led by the City of Rockford's Health and Human Services Department. Another partner is Cura, C-U-R-A, Strategies out of Virginia. And that particular company deals with communications, and it specializes in advocating for positive health policies. The partner in all of this is the University of Illinois, Chicago College of Medicine, and my office, the Office of Health Literacy. And last but not least, the College of Medicine Rockford campus is also engaged in this project. There are a number of Rockford community-based organizations, healthcare providers, and churches engaged in Rockford Ready programming. Now, you may want to know, what is Rockford Ready about? What are the goals and objectives of this important project? Well, one objective is to leverage the combined capacities of all the partners to encourage residents in the Rockford community to take a proactive role in the management of their health and to stop the spread of COVID. Now, some of our listeners may be wondering, what is health literacy? What is it about? Well, the National Academy of Medicine defines health literacy as the ability to obtain, process, and understand the basic health information needed to make appropriate health decisions. Can you believe that there are about 32 million citizens in the United States who cannot read and understand some of the literatures in our health clinics, in our community outreach programs, et cetera? So health literacy is only one small piece, by the way, of a very complicated puzzle known as the healthcare enterprise. Today, I am interviewing Pastor K. Edward Copeland, the lead pastor of New Zion Baptist Church in Rockford, Illinois, Dr. Yolanda Suarez-Balgasar, professor and head of the Department of Occupational Therapy in the College of Applied Health Sciences at the Chicago campus, and Dr. Olga Garcia-Boda, physician and associate professor of medicine, also at UIC. Welcome to our guest. We have much to talk about. And by the way, as I think about healthcare and where we need to go, we really need to help patients, communities interact with the healthcare system more effectively and efficiently. So the topic today is tips to prepare one for appointments with healthcare providers. And I'm going to begin with Pastor Copeland. Pastor Copeland, how do you prepare yourself to interact with your healthcare provider? Some helpful hints for our listeners.
First of all, thank you for having me, Dr. Paula. And the primary way I prepare is by preparing my mind to engage the doctor with what my concerns are. And the way I do that, usually, for me, the best way is to make a list of exactly what I want to talk about so I can make sure that I don't forget anything. Because sometimes, given the limited amount of time I might be able to see my doctor, and just the pressure of being in a doctor's office, things can slip my mind, I can forget some important details or whatever. And more importantly, sometimes I let the doctor take control of the conversation when I'm the one who needs the doctor and he or she is working for me. So I have to get this thing out of my mind that, okay, I'm just going to listen to what the doctor says. I'm going to engage. And if I need a script, I'm going to take some notes with me to make sure that I don't forget what I wanted to cover, because I have had the unfortunate experience in the past of sometimes feeling rushed or maybe being nervous because of whatever it is that I'm coming to talk about, that I forget some other major things that need to be discussed.
I'm with you 100%. I've made lists and then I get to the doctor's office, I forget my list and I get carried away on another topic and I leave saying, oh, my list is in my purse. Why didn't I raise these issues with my doctor? I am with you 100%. Dr. Yolanda, how do you manage? What are your strategies in terms of preparing for a visit with your healthcare provider?
Well, thank you for inviting me to be part of this show. Just to follow up on Pastor Copeland's comment, I try to engage with the provider. And one of the strategies that helps me engage with the provider is to get ready for it. So the phase of engagement needs to start before you go to the actual appointment. How do you get ready for that engagement? Think about why, in the first place, you're going to the doctor. You know, what are your concerns? I typically write down what is the reason that I'm going to the doctor. What do I want to get out of it? What questions I have, what concerns I have about my health, my functioning, and then write down not only those questions, those concerns, so you don't forget, because I often forget them, but I also think about what do I need to tell the doctor, what medications I might be taking, what herbal medicine, so what I'm doing at home that the doctor might need to know, and the doctor might be able to help me better, make the most out of that time. I also recommend for people who need interpreters or have a disability and need an accommodation to think about it before the engagement. So the phase of before the meeting and the doctor's appointment is very critical. If you need an accommodation, let the provider know that you need an accommodation, whether it's signed interpreters or any other interpretation. And also if you need language interpreters, because those do need to be secure in advance by the healthcare provider. And you do have the right to ask for an interpreter. So those will be my strategies.
You mentioned writing down the name of your prescriptions. I've done that, but on occasion, I have left off the list the milligrams of the, so bringing the bottles of medication with you with the milligrams, milliliters, the volume that you're supposed to take if it's a liquid, I think is important. I always forget to put the mg, so I like the idea of bringing the bottles with you so that if you have a new physician, they can at least know exactly what is the strength of dosage. So that's a fantastic suggestion. Thank you.
Absolutely. Yeah.
Dr. Olga, our MD on the panel, you have an inside perspective. You see patients about every 10, 15 minutes. Is that correct?
Correct. So thank you very much for having me. And absolutely, our time is limited when we have a patient. Depends on clinics, we have 10, 15, or 20 minutes, all right? So pieces of advice that I have for engagement, as Dr. Yolanda mentioned, is that you need to organize your thoughts before you come to the clinic. It's very important. It's what you make a list of what you want to tell your healthcare provider and the questions you want to ask, all right? In addition, you need to share your medical history. Tell your doctor about your previous illnesses, any surgeries, any medical conditions, any other doctors that you see. You may want to ask your doctor to send you a copy of the medical history form before you visit your doctor. Try to explain to your doctor if they have any surgery, what medications you take. And it's very important to give your doctor all the names of former doctors, a specialty, and if they're in a different city, all right? In addition, it's very important that you gather your medical history. So as you mentioned, you need to write your medications or bring the bottles, all right? Make sure that you know your allergies. Make sure that you know what happened or what symptoms they have changed. If you have a medical condition and any symptom has changed, you need to let us know. Something that is very important, and we talk about time, is that as physicians, we highly appreciate if you arrive 15 minutes before your scheduled appointment. It's very important. Arriving early helps ensure you have enough time to check in, complete any forms needed, and especially if you're a new patient as well. You need to ensure that the office takes your insurance. It's very important. Before you call or make an appointment, make sure that your office takes your insurance. If it's a new doctor, as I mentioned, bring all notes or records of your medical history. And be mindful that time is precious, so tell your doctor most important health concerns first. It's very important. If you have a list, make an effort to mention to the doctor what is the most important concern. And something that I found and that is really helpful for us is don't withhold any information. Physicians, we cannot help you if you don't tell us what is going on. What is your problem? Your doctor or nurse to repeat anything that you don't understand. If I'm speaking too fast or you don't understand the language that I'm using, stop and say, look, doctor, I don't understand. Can you please explain to me? If I order any test, please ask questions. What the test is this? Why do I need it? What is going to happen with the test? What are the results of the test? When I'm going to get my results? How I prepare for my test? It's very common that our patients, for example, give prescription to take medications, but they don't know if they have to take it on an empty stomach or after eating. How many tablets a day? If I take it in the morning, in the afternoon. Some of our patients works at night, or works during. So when they're gonna take the medications, what happens if you miss a dose? Do you have to double the dose? Do you have to wait until next dose? So those are questions that are very important for you to ask. And I suggest to make a list and come prepared to ask those questions. If you're going to have a test, or if you're going to be taking medications, or if you have new symptoms. And something that is, I say that it will help with the time, is that you should ask with the front desk to help you as well. People who check you in, the nurse may have information that probably the doctor doesn't have. Let's say how the office runs, where are the business dates that you can make appointments, how you can get in contact with the doctor, how can I ask about billing? So those are ways to engage as well.
Dr. Olga, I was in a doctor's office recently, did me an iPad, and they said, answer these questions. What about the move more towards technology and people being ready to engage in technology? So they hand you an iPad, they ask you all these questions, and I noticed there were a couple of people in the wait room who could not engage in the iPad. In other words, they weren't prepared to answer questions vis-a-vis this iPad. So a woman left her desk and came out to work with this particular patient. I'm just using that as an example of how technology is also impacting this notion of engagement, at least in some healthcare facilities. And then the other thing was the use of portals. Go to your portal and track your medical record, or we'll send you a refill on your prescription through the portal. So I think Pastor Copeland talked a lot about engagement. Now we have this technology that is also a part of this engagement and preparing all patients. I'm just curious about it. That's just a question that came up recently.
So, Dr. Paula, you mentioned about health literacy, right? Another domain that we have on literacy is digital literacy that we're seeing more and more. How we're going to be engaging our patients on digital communication. Everything is online. So yes, you're right. We're providing our patients with the iPads so they can register, or you can register online, or you can schedule appointments online. That is the way that we do it these days. What I will suggest for our patients that they have limited digital literacy is to ask the office. We have navigators in our office that will facilitate that process. And I will suggest to us a stepwise process is when you do not know how to use an iPad or how my portal works, is ask what is step 1, step 2, step 3, because it's going to be a process that you will say, I register digitally, they're going to send me a password, and then I can create an account. But this navigators and digital, I would say, IT support in our offices, that it helps patients engage in this digital era of communication with healthcare providers. That's one. Second one is that if you are not digital or savvy, we still communicate via phone, or we start hard copies as well. Something that Dr. Yolanda mentioned is not only ask for an interpreter, but the forms should be according to your language. If you want to read in a specific language, you should request the forms that they go according to your language. Right? So that helps facilitate communication with the physician and the office itself. And something that is as well important is education materials as well. That is to learn more about any condition, how to follow educational pamphlets or videotapes. That is going to help you as well with this digital era about signing up for forms. What my portal facilitates is easy communication very quickly at any time with your healthcare provider.
Thank you so much. As someone mentioned earlier, let's move the conversation to resources in the community. I'm thinking of your local pharmacist. He or she can play an important role in helping you to understand medication interaction or what this particular drug is for. I know that Pastor Copeland has, I've heard about the programming that you have, Pastor Copeland, to prepare your congregation to interact with the healthcare enterprise. Can you speak to that? And then I'd like to hear more about, from my colleagues, the community pharmacist and other resources in the community that can be drawn upon to supplement what you and your doctor or your healthcare providers provide for you.
So we have a parish health ministry that basically started in order to do some of the things that Dr. Garcia was just talking about, namely to help our parishioners navigate the system. So those who are in the ministry have some kind of background or certification in the medical field, and they're responsible that when we have events just to attend to the people. We've had several medical events, medical crises at events that we were having, but because we had the medical personnel sort of mobilized, they were able to handle it. But more importantly, they make themselves available to go to doctor's appointments, particularly with our senior members. And we had to start something probably about 5 years ago. And all of this, I'm not smart enough to come up with this because things have happened. Like we had one lady who had a tremendous crisis, got her in the hospital. And what we found out was she had probably about 4 or 5 doctors, but they weren't communicating with one another. So we had to have navigators to go in and just sort of help people understand what was going on. And that prompted us to do something else, which is annually have people list, we give a little form where they list all their medications. And those who are willing, they leave a copy here at the church. So that if something ever happens to you at the church, and this has actually happened, we can pull out and say, okay, here's the medications that they're on, because some of our senior saints, we ask them, okay, well, what are you taking? Well, I take a little orange pill and I take a little blue pill. That don't help us. We need to know what it is.
Right.
If you're in crisis, we've had this happen. Somebody falls out and we're like, okay, well, go get the report. And we can see when the paramedics come, okay, well, here's what she told us the last checkup we had with her.
Wow.
Here's what she said that she was on. And then they can go from there. The main thing, however, is we try to create an atmosphere through our preaching and our teaching and bringing in various speakers and all that kind of stuff, an atmosphere of advocacy for your own health, that you have to take control of your health. And there's some things that you can do And the main thing, we try to make it as simple as possible. Every Sunday, before we leave, we tell everybody and we speak to one another, eat your colors. Now I could tell them,
Can you tell me what that means, eat your colors? I
it
don't.
means when you look at your plate, we say eat your colors, and fried is
Right.
not a color. What we mean by that is your plate should have different colors on it, because God is so gracious. He knew we weren't going to do right, so he color coded food. So that if you just eat your colors, and half your plate should be green. So green, and then
I remember this, eat your colors, okay.
and Skittles, that doesn't count, neither the fruit.
Skittles are beautiful in color.
No. I'm talking about
They're
vegetables.
orange.
eat your colors. If I say
I'm giving you a hard time.
if I say eat your vegetables, or you need these many calories or whatever, they ain't gonna do that. But if I say eat your colors, that's simple enough a child can understand. Okay, and when I see you out at the restaurant, I say, okay, what kind of colors do you have on your plate? And it becomes.
Oh, you monitor them. Oh my goodness.
No, we monitor one another. Hey, what are your colors?
Oh, that's funny. That's great. Eat your colors.
Eat your colors. Drink more water. Move your body. And we just added a new one, plant something green, because that deals with the mental health aspect. And more importantly, with food prices so high, we're asking people to just have their own little gardens. And then the last thing we say to everybody before they leave every Sunday is go lay your fat head down. What that means is get some rest. I mean, you have to maintain your body, and it's your responsibility. And so take charge of your health by doing the things that you can do, and then be prepared to engage those who can help you when you don't know what to do.
Well, I think we can promote you from pastor to also pastor and Dr. Copeland. You can join the medical field here. My God, eat your colors. Remember that, eat your colors. Great words of wisdom. Yolanda, do you have anything else to add to Dr. Copeland?
Yes, first of all, I love your ideas, Pastor Copeland. I'm definitely going to follow them. But the last message I would like to communicate is that often individuals out in the community, because of linguistic or cultural issues, might feel more comfortable going to the doctor's appointment with a support person. This could be, it needs to be an adult. Don't bring a child or an adolescent. It needs to be an adult, but it could be a support person. If you don't have a support person, an adult who feels comfortable with the cultural differences, the linguistic differences, and can help you and support you throughout the appointment. If you don't have access to one, many community agencies do provide promotoras, support systems, and promotoras are people from the community that could help you navigate the healthcare system and might be able to go along with you and support you and also help interpret. So you're not alone in this. There are resources out there in the community that you can tap into, and bring in a support system, a navigator, a promotora along with you, or an adult family member willing to help you navigate the system, because the system is not easy to navigate, but it's possible to navigate.
What wonderful words of wisdom.
Thank you.
They really complement Pastor Copeland's remarks, who's now Dr. Copeland. Okay. Okay, you have a new faculty member joining you. Oh, do you have any last words for us, Dr. Garcia?
Very interesting points from Dr. Copeland and Dr. Suarez. But I would say something that is important is, as you mentioned, make a list, organize before and prepare for your appointment. Make sure that you write everything that is important that you want to discuss with your doctor. Even you think it's small, write it down. It's not a problem. When you come, show us your list. We'll be able to work together. Get to know your doctor's office, the staff, the care coordinator, the nurses. They're very helpful. They will help you navigate the system, whoever that registration. Something that Dr. Paula mentioned is your pharmacist. It's very important to partner with your pharmacist because sometimes you take so many medications that you don't know what is interacting. And it's not only interaction between medications, interactions between your medications and the colors that you eat, right? Sometimes, so you need to be mindful. So you can eat the colors and take your medications, but we need to have them. So those are things that your pharmacist, your local pharmacist can be helpful. Even our offices, they have a special pharmacist that they will help you understand your medications. Right, make a list. As we discussed, there's a special organizations like religious organizations like Dr. Copeland that will help you with resources. That is an excellent resource of navigating the healthcare system to find like that person who will help you. Come, write notes, help me understand. Let me connect the dots. How we can create a huge, a great puzzle, put it together and help me with that healthcare system. And something that I found is really, really important, explore resources that can help you pay for medical bills and prescriptions.
Yeah.
Please, if you don't have, or you can have the money, or you cannot afford a medication, ask your doctor. Sometimes we have resources, we have discounts, we have, I will not say partnerships because it's not, but sometimes the pharmaceutical companies, they come and say, look, we have these program that it can help your patient if they cannot afford the medication. So something that is very important is find resources that can help pay your medical bills. There's online resources that it can help you with prescriptions as well. So look for those resources. Look who can help you. There's organizations in the community help you pay for medications as well. So that's my last comment. And
Great.
Thank you,
Great
Dr.
comment.
Paula.
Dr. Copeland, and I'm calling you Dr. Pastor Copeland.
Actually, I do have.
I'm
Actually, I do have a doctorate, but it's just not in medicine. So you're not.
Oh, okay, well, I'm right. See, do you have any last words for our listeners?
Yeah, just one last thing. Make sure your doctors, if you have more than one, are communicating with one another. I have elderly parents, and there's been a few times where there were some missteps or some things that could have really went wrong had my sister and I not been advocating, well, you're prescribing this, but have you talked to the heart doctor or have you talked to this doctor or whatever? And they didn't know that some other medication, was being prescribed. And so it's very important to make sure the team is communicating one with another.
Thank you so much. Thank you.
Can I ask you last, Dr. Copeland and Pastor Copeland, you mentioned something that is really, really important. You need to advocate for your healthcare. It's key. If you don't come and let me know what are your problems, how do you want me to help you, it will be impossible for me to help you. So you need to advocate. I will say, I think it's very important that I want to empower my patients to take care of themselves. It's a team effort. It's not it's basically a team effort.
So to close out, eat your colors, be engaged prior to your actual visit. Think deeply about how you're going to utilize that time with your physician, right? Am I summarizing the major points? And advocate for yourself, right? I mean, you have to advocate for yourself in terms of getting quality care, right or wrong? What my panelists, you all agree? Dr. Olga, Dr. Copeland, and
Absolutely.
okay.
Amen.
Well, thank you to our guests, Pastor Copeland, Dr. Yolanda Suarez-Bogazar, and Dr. Olga Garcia-Badoa. I would like to thank Mark Miletus for use of excerpts from his original composition, Music for 5 Musicians on our show. You are listening to UIC Radio, broadcasting 24/7 at uicradio.org in partnership today with SOAR Radio, located in Rockford, Illinois. Thank you all. Thank you, and have a good day.
Thank you.